Good morning, and welcome to this edition of Medical Minutes, brought to you by Passavant Hospital. I am Dr. Peter Russotto, your host and moderator. Today, we will be talking about Medicare and health insurance with Lorna Legreid. Lorna has been at Passavant Hospital for 28 years and is the Medicare insurance consultant. She brings a world of knowledge to the complex and sometimes confusing world of Medicare and health insurance. Medical Minutes is excited on having Lorna here because this month Medicare celebrates its 50th birthday. So welcome, Lorna. Can you tell us, the listening audience, how your position and services actually came about here at Passavant Hospital?
Yes, Dr. Russotto. I was hired back in 1987 by Mark Steinberg, who at that time was the business office manager at Passavant Hospital. The Medicare population would bring bags of paperwork, bills, insurance, Medicare explanations to the counter and need help in sorting and understanding what was paid, what was due, what needed refiled, etc. At that time, the personnel in the business office did not have the resources or the time to assist these folks, so they created this new position, and I stepped into the role. While this is still a major part of my role, I also do a great deal of counseling to individuals who are new to Medicare. You have many choices to make as you retire and become eligible for Medicare, and I try to guide you to the best options. I have also assisted people to apply for their Medicare and Medicaid benefits. I can be reached at Passavant Hospital by phone. The number is 217-479-5573, Monday through Friday. Please call for an appointment today. My email address at Passavant is Legreid, Legreid, .Lorna, Lorna, at mhsil.com.
Well, thanks, Lorna. Concerning Medicare, how can I or any of the listening audience learn a little bit about the nuances and about the history of Medicare?
Well, I will be presenting a Medicare program at Passavant Hospital on July 30th of 2015, and this is Medicare's 50th birthday. Back on July 30th, 1965, President Lyndon B. Johnson signed Medicare, a health insurance program for elderly Americans, into law. In the ceremony, which took place at the Truman Library in Independence, Missouri, former President Harry S. Truman was enrolled as Medicare's first beneficiary and received the first Medicare card. President Johnson wanted to recognize Truman, who in 1945 had become the first president to propose national health insurance, an initiative that was opposed by Congress. This program will be at Passavant Hospital on Thursday, July 30th, 2015. This program will be in meeting rooms 2 and 3 at 10 a.m. If you are interested in attending, please call 217-479-5800 to register. This program is free and open to anyone in the community, but registration is required. And the Medicare Insurance Counseling Program is a free service provided by Passavant Area Hospital as our commitment to community benefit.
We talked so far a little bit about Medicare, and there's always a confusion of the difference between Medicare and the Medicaid. Can you talk a little bit about those differences?
Yes, I can, Dr. Russotto. Medicare is the federal health insurance program which began back in 1965 for people 65 and older and people under 65 with certain disabilities. This includes people with end-stage renal disease requiring dialysis and ALS, which is Lou Gehrig's disease. For 50 years, Medicare has been a reliable guarantor of the health and welfare of older and disabled Americans by paying their medical bills, ensuring their access to needed health care expenses, and protecting them from potentially crushing health expenses. And what Medicaid is a joint venture between the federal and state government as health insurances for limited income and asset individuals. Medicaid was expanded in the state of Illinois under the Affordable Care Act to include individuals between the ages of 19 and 64 with limited income. You can call me directly at Passavant Hospital if you want the specific dollar amounts to be able to apply for Medicaid benefits.
So there is some actual brackets of which a person's income or families have to be under in order to qualify.
Yes, indeed. And I don't want to go over all those now, but I do have that information if you would call me at Passavant Hospital, and we could even help you apply if we needed to.
Another name for that program is a lot of times people call it public aid, correct?
That's exactly right. Medicaid or public aid. Yes, indeed.
We talked about, again, Medicare, and now there's these different replacement or advantage plans. Can you talk a little bit about that?
Yes. There is traditional Medicare, which has been around for, 50 years, and then these Medicare Advantage plans have kind of popped into play. With traditional Medicare, your claims are processed and paid by Medicare. You have a choice of doctors and hospitals and other healthcare providers that accept Medicare. Most people with original Medicare will also carry a Medicare supplement plan or a retiree plan, or they might have military benefits, or they may have Medicaid to supplement their Medicare. People with traditional Medicare will generally have to purchase a Medicare Part D plan to have their prescription drug coverage. So that's basically your traditional Medicare, which the majority of the population would have. You can also choose a Medicare Advantage plan or a Medicare Replacement plan, and your coverage would then be through a private insurance company. For example, in our area, we have Health Alliance, Humana, United Healthcare, Coventry, just to name a few. And in most of these plans, you would need to use network doctors, hospitals, and other healthcare providers. Depending on the plan, you may pay more if your hospital or doctors are not in their network, and it's very possible the plan would pay zero if you went out of network, and you would owe the entire bill. So I would strongly advise you to check with your hospital and doctors to be sure they accept these plans before enrolling, because you would be covered for the entire year until the next open enrollment. And most of these plans would also have a drug benefit. So these plans may be kind of enticing because you may have a cheaper premium for the plan, but you could have high co-pays when you visit the doctor or when you end up in the hospital as an inpatient.
I'm glad you mentioned about the whole year enrollment, because I've personally had some patients that didn't know exactly what an Advantage plan was. They didn't like what the payment was, and they thought, well, next month I'll change. That's not possible. You are enrolled for the whole year until your open enrollment. So it really behooves you as an individual to understand exactly what you're signing and getting yourself into.
That's exactly right. And I think a lot of times when the senior population doesn't quite know what they're signing up for, and they've gotten kind of lured into these plans without fully being knowledgeable of them. So just be cautious.
That's a very good point. When we talk about Medicare, there's also sometimes very confusing for the individual when they get into the hospital. There's different types of what we call Medicare beds in a hospital, whether it's an inpatient or observation status. Can you talk about a little bit of the differences for those individuals?
Right, and that's a kind of a touchy point, probably at most hospitals and even at Passavant Hospital, where observation services are hospital outpatient services given to help the doctor to decide if the patient would need to be admitted as an inpatient or can be discharged from the hospital. And this can include emergency department services, observation services, surgeries, labs, tests, and other hospital service that your doctor hasn't written and ordered to admit you. And you can still be an outpatient under observation and spend several days in the hospital. Maybe your doctor is just trying to pinpoint a little bit more what ails you. If you're listed as an observation patient, Medicare Part B will pay your charges, generally at 80%. You would be liable for the 20% coinsurance plus charges for self-administered drugs. And self-administered drugs are charges for oral pills, sprays, ointments, drops, and some injection medicine. And these charges can be very expensive in a hospital setting. So you just want to always be sure if you're a full inpatient or an observation. If you have questions on that, ask your nurse, ask me if you're at Passavant Hospital, and I can let you know.
I can assure the patients, though, because it is confusing, and I've had some patients actually say, well, am I going to be denied, the care? I guarantee you, no matter what status you're in, the physician, Passavant, we're going to do what's best for you at that time. It does make a little differences for the insurances, but we will do what's proper for those individuals.
Yes, absolutely. It's always in the best interest of the patient at Passavant Hospital.
You talked a little bit about Medicare Part D. That's the drug plan, but there's a donut hole in that drug plan. It's very confusing for the individuals. Are there also any programs to lower the cost for drugs for the patients that have a Medicare Part D?
Yes, there are. What Medicare Part D is, it's the prescription drug benefit. It began in 2006, and in Illinois, there are over 30 drug plans to choose from. So that makes it difficult just for a senior to pick which plan they would like to have. And if you purchase a Part D, you pay a monthly premium to a private company, and you generally have a copay at the pharmacy. The coverage gap, or donut hole, with Part D begins when you reach a dollar amount in total drug cost. And this year, that dollar amount is $2,960. After this point, you pay a higher percentage of your drug cost, 45% for your brands and 65% for your generics. So it's really kind of expensive. And if you reach over $6,000 in total drug cost, you would be in catastrophic and have a lower copay. There is a program called Extra Help through the Social Security Administration that if your income and assets are under their guidelines, you could qualify for help paying your copays, help paying your premiums. And again, I have those figures at my office. You're welcome to call me, and I will be glad to relay that information to you.
I want the listening audience to also realize, and Lorna can tell a little bit more about this, but Medicare, we're just scratching the surface when we're talking about some of these restrictions, does change their rules from year to year, and sometimes the deductibles go up a little bit, but Lorna can shed some light on that if you call her. We're just touching and scratching the surfaces of all the nuances. I would recommend people to call and utilize your services because it's wonderful for the patients to understand exactly what their insurances provide.
Yeah, I think it has been a wonderful program that Passavant began way back those 28 years ago because we've certainly helped a lot of people, and it's helping families. I'm getting into the children of the parents that I helped back 28 years ago, so it's very exciting.
And I know this discussion today was mainly on Medicare because of its 50th anniversary, and we talked about Medicaid, but Lorna is here to help individuals with private insurances, Blue Cross Blue Shield. They have rules, regulations that are sometimes hard to understand, circumvent, and she can give you a lot of knowledge on that, correct?
That's absolutely right. We try to answer any questions we can for any individual who calls in. We can set up an appointment to help them. We can try to answer their questions over their phone, whatever works out best for that individual.
Yeah, she acts as your intermediary sometimes. And sometimes people want the answer right then and there, but I guarantee you Lorna will get the answer, whether it be 24 hours or 48 hours
Absolutely. Later. Absolutely.
Well, Lorna, thank you very much. That was an excellent interview here. But do you have anything else that you want to maybe tell the listening audience?
Well, I guess I just really want to make sure people are aware that the program that I am doing on July 30th, 2015 at Passavant Hospital, you do need to call and pre-register because those programs really fill up fast. So the number to call to make the reservation is 217-479-5800.
I encourage you to call early because it is a limited space, so it can fill up quickly.
Right, it is indeed. And last year, in fact, I did 2 programs in the same day because we had filled up the first program. So that was excellent for our Medicare population.
Well, thanks again, Lorna, and thank you to the listening audience.